Welcome to another segment of ACRP TV. Today, our spotlight is on ACRP's Diversity Advisory Council, and we're speaking with thought leaders and members of this new DAC to talk sort of about their hopes and dreams for this committee and how they got into the field. One of the people on this committee we've talked to many times in the past, Marchant, who's the director of the Clinical Trials Administrative Office at the University of Alabama. Mark, thanks so much for joining us today.
Yeah, thank you, Michael. I appreciate the opportunity to be here today.
Now, one of the things I enjoy doing in these segments when I talk to established career people like you in this field is to ask how you got into this industry. And I've said before, I don't know if I've heard the same path twice, which is emblematic of what's going on in this industry and one of the things we're all trying to fix. But how did you get involved in the clinical trials industry, Mark?
Yeah, absolutely. I probably fit in in that same bucket just like everybody else. So sometimes I say I fell into it. Other times I would say it was divine intervention, however you want to look at it. But it was definitely not something that I started off in high school saying to my guidance counselor that this is what I want to be when I grow up, right? So actually the roundabout version of how I wound up here was that actually in my prior life, I was actually an environmental health specialist. Some people would call them a health inspector or sanitarian for various county health departments in 3 different states, actually, including Alabama, but also Montana and Georgia. And at that point in time, I was actually working in Georgia and was looking to return to Alabama where I had grown up. I'd actually been away for a little while. And so a former classmate of mine from undergrad at UAB was working in alumni relations at the UAB School of Public Health. And so as a former alum of the School of Public Health, she reached out to me and let me know about a job opportunity working in clinical trials here at UAB in rheumatology, specifically in the regulatory realm of clinical trials. And so I applied and was subsequently interviewed and hired, despite the fact that I knew nothing about clinical trials. And like I said, had worked solely in the public health space prior to that. In fact, I knew so little that the term IRB was used in the context of my interview because it was a regulatory type position. And I had to ask them what that was because I had no clue. And because of the fact that they honestly just took a huge chance on me, bringing someone in net new with no prior experience, I've always been a huge proponent of hiring people who seem to have the right soft skills, but maybe perhaps not the hard skills or the quote experience that we're looking for as hiring managers often. And so we can, definitely teach those hard skills to people if we have the bandwidth and obviously the patience to do so.
Now, you've stuck around in this industry quite a while. I won't date either of us, but we've both been doing this for a while. Obviously, we both kind of like it for whatever reason. So talk about, why it's not always easy, but why have you stayed in this field? Obviously, there's some rewarding elements. Or talk about what's kept you around in the clinical trial industry.
Yeah, absolutely. So actually, to go back to where I started, my initial months of coming into this space, like I said, it was kind of a tough transition because I went from working out in quote the field and being out in the community in the open air, working with people on a day-to-day basis, out in their element, honestly, within the context of their businesses and their communities. And then I suddenly found myself working behind a desk, from daylight to dark and with lots of paperwork and interacting with just a very finite number of people. To compound that issue, I was actually, my office was located in the basement of our rehab hospital here at UAB. So there was honestly a lot of days where I didn't see the light of day. So I would get to work while it was still dark, and I left in the evening and it was already dark. So it was I guess a difficult transition from that perspective, to say the least, in terms of going from what I had previously been doing to what I came into. But on top of all that, the things that I really fell in love with was the fact that I was working in cutting edge medicine. And I've always been a person that's kind of, I guess, a more entrepreneurial spirit, like to work on new things and doing new stuff. And plus it just fit my natural type detail-oriented nature to my personality. And so that was honestly just a perfect fit for somebody working in the regulatory field. So you couple that with all the abundant opportunities to learn other aspects of clinical trials, the financial pieces, the contractual pieces, the non-clinical pieces, which, by the way, I'm not a clinical person, so I don't have any type of formalized medical training. So I definitely come to it from strictly an administrative perspective. all of that really was a great fit for me. And so it just was something that I immediately kind of took to once I got through the initial bumps of that transition. And you coupled that with the fact that we had at that time in the unit I worked in for the first 7 years of my career, a very family-like atmosphere of the staff with whom I worked, and really just enjoyed working with on a day-to-day basis. So I just had a great amount of joy, and I found it very rewarding, really career on a day-to-day basis. And so that's really what kind of brought me to where I am today.
Let's turn our attention for a second to potential new entrants in the workforce, or people maybe who have been established in a different career, or maybe they're considering a career change. They vaguely heard of clinical research. COVID has certainly made it a big part of the news on the front page in the last year or so, when it generally hasn't been getting that much national coverage. So people are more aware of it as a field, if only a little bit. What would you say to people who are considering looking into clinical research as a profession?
Yeah, absolutely. And this is honestly something that I've spent a fair amount of time doing over the last several months to a couple of years, is really just trying to shine the spotlight on this as a career. So honestly, I would describe clinical research as a kind of a hidden gem of a career. There are just so many aspects of it, just due to the vastness of the opportunities relative to the roles that someone could serve in, the positions, the types of research that's being conducted, just the variety there, as well as just the locations. I mean, obviously, you're just not pigeonholed to one area of really the country or the globe in terms of what we do on a day-to-day basis. And so all of those things, in my mind, brought together really just ultimately prevent boredom or stagnation.
Well, I like hidden gem. I wrote that down when you said that. That's a nice way to look at it, because that's exactly how I feel. That's a good way to articulate this career. Hey, before I let you go, let me ask you finally about ACRP's new Diversity Advisory Council. You're part of it. It's been around we're in May of 2021. It's been around 6-7 months. I know you've had some meetings, you've got some action steps, some things on the drawing board, but talk about why you're part of that committee, why you're excited about it, and why it's so important right now.
My hope through participation in this council is that somehow we're able to impact the workforce in a way so that all populations, regardless of demographics, feel connected in some way, which ultimately turns them to want to engage in the trials, no matter how large or how small, and that they ultimately know that what they are doing makes a difference and it truly matters to mankind overall.
Sounds like a good calling. This is ACRP TV Spotlight on ACRP's Diversity Advisory Council. We've been speaking with Mark Marchant, who's the director of the Clinical Trials Administration Office at the University of Alabama. Mark, thanks so much for joining us today.
Thank you, Michael. Appreciate it.